Hey guys, we're going to start and give it a little bit longer. Make sure we get more folks logging in. Lynn Matos, what's up? Good to see you, Lynn. Thank you for tuning in. Angel Lewis, hope you feel better, brother. Hope you're doing better, brother, okay? Let me see who else we got in here. Larry Borman, just got on. Larry, good to see you. Thank you for logging on. Give us about 2 more minutes, maybe a minute, 30 seconds, so we can get some more folks coming in. People get their Facebook alert, and we want to make sure they have a chance to log on, so we can let them know what are the rules that will be coming into play next week. I mean, not next week, tomorrow. So give us about another 30 seconds. Give us another 30 minutes. Not 30 seconds, sorry. There's 19 people watching right now, so. Alice, how you doing? Miss Cruz Acevo, good to see you. Jenny, buenas tardes, good afternoon. So everybody, welcome to our COVID-19 update. We wanted to move it up. We're also going to have Mental Health Thursdays, but we want to move it up to today because I know that there's going to be some changes to the county executive order that go into effect tonight at midnight that will be impacting many businesses in our community and just the way that we go about our daily lives. And so those changes, we want to make sure that we get them out to you. Melanie, thank you for joining us. Bienvenido todo el mundo para el COVID Update aquí de nuestra comunidad. Lo movimos hoy al miércoles porque van a haber unos cambios de las regulaciones que se van a cambiar hoy por la noche. Van a hacer el cambio para mañana. So vamos a ver qué van a hacer eso. Yo tengo un administrador aquí para hablar de los updates y todo lo que está pasando aquí en nuestra comunidad. Mr. Manager.
Yeah, just wanted to start by talking about the state's report, the numbers of people that are testing positive for COVID-19. Today's state report indicated that in total there's been 286 people. That's a change of 100 people in 1 week. A third of the people in Miami Lakes who have contracted COVID-19, they've contracted it or they have been tested positive in the last week. So as you see, there's a dramatic spike, a dramatic increase in the number of cases in Miami Lakes, in Miami-Dade County, and really in the entire state of Florida. And I think that's why you're seeing some of these measures that are being taken at the county level. It's in response to that. Le quería avisar que el reporte estatal que salió hoy indica que en total han habido 286 personas que han sido positivos para el coronavirus. Es un aumento de aproximadamente 100 personas en la última semana. O sea que más o menos un tercio, una tercera parte del total se ha visto en la última semana. So, ha habido un aumento increíble en los últimos días. Que se ha visto aquí en la ciudad de Miami Lakes, igual que se ha visto en el condado de Miami-Dade y en el estado de la Florida. Por eso es que hemos visto los cambios que se van a implementar, empezando, como dijo el alcalde, que se van affect many of the businesses here in Miami Lakes. The restaurants primarily is the one that they had some reprieve several weeks ago, and it had been allowed to reopen with limited capacity, and now the inside dining is being closed. Restaurants are still going to be allowed for takeout, and also outdoor dining is still going to be allowed. Indoor dining is going to be shut down. Initially, the reports were that gyms and fitness centers and those types of businesses businesses were going to be shut down, but there was a change there. They changed it with the caveat that nobody inside of the gyms or fitness centers could remove their mask. And the way it was explained to me that the reason that the restaurants and the fitness and gyms were targeted is that those were the only two kinds of businesses that at some point people were allowed to remove their mask. So I know people feel that some of them there was selective targeting, but really that was the medical background behind it, is that those were the kinds of businesses that at some point indoors, people were allowed to remove their mask, and that's what they were trying to hacer que mañana, empezando mañana, el cambio nuevo volver a abrir hace varias semanas, un límite de capacidad, pero mañana los restaurantes van a tener que cerrar de nuevo para la gente que se sienten adentro del restaurante. O sea, todavía si hay mesa y silla afuera en el área exterior, esas sí se pueden seguir sirviendo, y obviamente para delivery y takeout eso va a seguir. Inicialmente habían hablado de los gimnasios y los centros de entrenamiento, que eso iban a cerrar las últimas 24 horas, que se cambió y pueden seguir operando, pero todo el mundo adentro de los gimnasios, adentro de los centros de entrenamiento, siempre tienen que mantenerse con la cara cubierta. Como se me explicó a mí, que la razón o el pensamiento que tuvieron en mirar a los restaurantes y los gimnasios fue que esos eran los únicos dos tipos de negocios que en el área interior en algún momento la gente se podían quitar la careta, y por eso fue que miraron esos dos tipos de negocios inicialmente, pero han habido algunos cambios. Los centros de entrenamiento sí se van a poder mantener abiertos, pero con todo el mundo adentro con la cara cubierta todo el tiempo.
Look, I think one of the things that we're really missing here is data-driven decisions, right? Contact tracing. That's one of the promises that was made way back when. It never happened here in Dade County specifically. The Florida Health Department is doing that. So I think that's been one of the major issues. I know yesterday I was with some of our elected officials that represent Miami Lakes, and I know some of the concerns is, look, there are people having major parties at their homes, 20, 30, 40, 50 people, huge parties. You can't stop those, right? Government can't come in and stop people from having get-togethers in their homes. But that is a major source of some of the issues that have come up, and I heard that yesterday. When you're in an indoor space with 40, 50 people, you're talking this and that, and you're not wearing your mask, then the level of possibly getting the coronavirus increases exponentially. Same thing, I mean, I heard from the commissioner, our county commissioner yesterday, we were at a press conference. He was talking about protests and folks in large groups on both sides speaking this and that, and if you're not wearing your mask, how easy it is to transmit COVID in those types of situations. Look, so that we know that's probably one of the reasons why the county oversees those types of businesses. The county gives BTRs so those businesses can pull it whenever they want, it can regulate them, but they can't regulate free speech, they can't regulate parties in people's homes. But we know that the contract tracers have shown no data that these things come from directly attributed to gyms or restaurants. I know I was talking to the mayor of Miami yesterday, who was in touch with all those folks, and he had told me himself he hasn't seen that from his discussions. But what I do want to say is that Mayor Jimenez himself is getting explanations from infectious disease experts, epidemiologists, who the reality is this is a novel virus. So the opinions of epidemiologists changes every day. I remember when it first started happening that they were saying, hey, surfaces, you touch a surface, the contamination rate, that all changed. The more that we know about this virus, it changed it. I know at first they said that asymptomatic people were super spreaders of the coronavirus. Then it came out, the World Health Organization, that was not the case. So that's one of the things that is so difficult, I guess, for decision makers all around, is that this changes every day. People's opinions changes every day, and the reality is the opinions of the epidemiologists change every single day. But what we do know that there is data. There's data that has shown that ICU beds, the people going into hospital for ICU beds has increased. I know some of that data started flattening out. The last 3 days, there are more people leaving the hospital again, which is great news. I do know that the two huge field hospitals at the youth fair and at Miami Beach are not being used. Actually, I believe the one at the youth fair was dismantled, or the one in the beach was dismantled. But both of those have never been used, so which that is good news. But we got to make sure that our hospital system isn't overwhelmed. But we have to keep investing in contact tracing. I was talking to the town manager today. There's a lot of money that the county has that we can work with the county on those types of things. But I just want to make sure that our residents get as much information as possible. But what is factual, that if you wear your mask, even if you're around a lot of people and you have your mask on right, the chances of you getting coronavirus decreases. But if you're at a club, I think we've seen videos of people partying at restaurants or whatnot. If you're at some of these places that now they're closed and you're not wearing your mask and there's a lot of people, your chances of getting COVID-19 increases exponentially. So that we do know. Do we have any questions? Clarissa?
We don't have any questions at the time.
We don't have any questions at the time. I see Rosie Barroso just got on. Rosie, good to see you. Barbarita Reyes, Barbara, good to see you. Marianela Alvarez, great to see you guys. Thank you for tuning in. It's so important that you tune in, share the information with your neighbors. But yeah, there's going to be some major changes that start tonight at midnight, and we hope that the impact, the economic impact, obviously isn't too great for some of those local businesses overall, because we know it's a domino effect down the chain. Anything else you want to add?
No, it's just that the difficult thing, as the mayor said, is that this virus is novel. They can do some predictive modeling based on how other novel viruses have behaved, but this one seems to be having very unique characteristics, which is making it difficult for the medical professionals to predict what it's going to do, etc. The good thing is that they obviously have opinions and they have been adjusting, which is wise, because as they learn and get more information, they are adjusting their suggestions. But they're based on fact. They are experienced, but they have been making changes, which is important, right? Because we have learned so much over the last 4 months. And now we're better prepared to address this virus. But the final thing I just wanted to touch on is, as the mayor had spoken about, these parties with large numbers of people, we all have to have personal responsibility, right? We can rely on government for advice or rely on other people to do their part, but we, each and every one of us, have to have our personal responsibility and make sure, as the mayor said, whenever we're out in public, especially in indoor spaces, to make sure we have our faces covered.
Absolutely. Antonio, good to see you. Clarissa, I do see one question. Are there any others? How does Alice Cruz say, well, how does contact tracing work? I don't know if you want to get into that, but I know specifically when somebody gets diagnosed, one of the things that's so important is to trace it back, right? See who else they were in contact with. I'll give you guys a perfect example because you shared it with everybody. Our vice mayor. When our vice mayor was diagnosed with COVID, so was his wife. Which I know they're improving, or they're better now.
Yeah, I think that his wife already had 2 negative results.
Good. So, but for example, with our vice mayor, he contacts everybody that he was in contact with. He finds out who's the person that gave. They go down the list. An actual contact tracer, a person, an employee of the state of Florida or the county, comes out, documents that, and goes down the line to make sure that we get down to the point of what happened, where's it coming from, getting that data to see where are the real infectious areas. Should we be reopening beaches? Should we be opening this? Should we be doing that? And I think that data is so important. And I don't know, me personally, I know it's going to be starting soon in Dade County. I don't know if we want to talk about that, but I hope the county does that. They need to hire contact tracers, and I know that's been one of the promises. The governor and the county mayor talked about it yesterday, and I believe that's going to be moving forward hopefully soon. But those individuals that go into communities representing the Miami-Dade Health Department, representing the State Health Department, and getting that data, because you need, if we're going to make decisions to continue reopening our economy, to closing down businesses, to doing this and that, you need to be able to show the data that they're contributing to. If it's a restaurant, if it's a gym, if it's the beach, you need to get that data that's contributing to the rising cases. And that's why it's so important in the decision-making process to have contact tracers. I don't know.
Yeah, and the contact tracing, not only did it allow the vice mayor to trace back and figure out this is how I got it, and do that kind of steps backwards, but also from the time that he knows he got it, because he was able to trace back, moving forward, he's able to determine, well, since that time that I got it, I was in contact with this person, with that person, and so forth, and then be able to notify them so those people can self-isolate and go get tested. So, and I think that's the real key to trying to limit the spread. Once people know that they were exposed to somebody who got the coronavirus, then that's incumbent on them to self-isolate and get tested and make sure they continue their isolation until they get the results of their test. And if it's negative, you're back out in the community. But if it's positive, then you have to wait until you get the negative test.
And there were interesting things in the order that the county mayor talked about. He even talked about how you have to have your music. You can't be blasting music at a restaurant or even at a gym at a loud level, because I guess that gives people more of an opportunity to sing, and then they say the louder that you speak or you sing, there's more chances that the virus spread. This is according to the epidemiologists and the infectious disease experts that speak to the county mayor, not us. I mean, we don't get that type of information directly, but I know that those are the little key, because they really believe that if you're in a situation like that, people are having fun, the louder that you speak, the more chances of spreading the coronavirus via the droplets being released, right?
Yeah, exactly. That's why there's so much concern, unfortunately, with religious ceremonies, right? With the religious ceremonies that have large choirs. They were saying that was an opportunity to dramatically spread the virus. So many people singing so loudly, a large number of them, and in close contact with parishioners, that was an opportunity. So that was one of the examples that they laid out. But anywhere where people have the opportunity to speak loudly, without a facial covering, or sing, I think it's an opportunity to pass the virus along.
And it goes back to the contact, important to have that on a mass scale, because then you can showcase not only anecdotally, that it happens, but you can showcase with real data where it's being traced from. If somebody had it at wherever it was, at the church, or and they spread it, you can see that. And that's why that data-driven decisions are always the best decisions, especially in public policy. Any other questions?
We have Antonio Lopez Perez mentions that he's seen an increase of cars at testing locations, and would like to know if you have any information or suggestions of where would be a good place to get tested, and that the results aren't taking more than seven days.
Yeah, all of the testing locations that we have here in South Florida really are being severely strained. They're being the following day. I got my results back. I walked right in. That same place, I had to spend over an hour on the phone the other day on hold, waiting just to speak to a human being to be able to make an appointment. I persisted. I finally got through to somebody and I made the appointment, but even the appointment was going to be for 3 days later. So those are the kind of things that we're seeing. I know we are working, and we haven't unveiled this yet, but we're looking to see, we're working with some of the medical laboratories in the neighborhood, in the South Florida, to see if we can bring some type of testing for Miami Lakes residents here locally. So once that happens, we'll unveil that, and we're working behind the scenes to make that happen. And once we do, we'll come out here and we'll announce it to all.
Yeah, one of the things I personally want to see is more deployment of rapid testing. See if we can get faster testing, the 7 days and stuff. I mean, it kind of creates a lot of uncertainty. Better, so I do want to see, hopefully nationally, even here locally, that that process of rapid testing come out. I read an article that there's a new rapid test that is being released. I think you get your results within 20 minutes. So I do hope that we see more of that happening. Any other?
Yes, we have Lilian Lopez Leon Gonzalez. Is the town considering to allow restaurants to set outdoor dining for those?
Yes, once the restaurants were reopened with the capacity limited to only 50%, from the beginning we've been working with any restaurant that wants to consider it. We've been working with restaurants to see how we can help them to set up outdoor seating. There are some limitations, like the landlord, the owner of shopping centers, etc. Those they have a say in it. But any restaurant that wants to explore outdoor seating or expansion of already existing outdoor seating, we're ready and willing to work with them and be able to sit more people in the outdoors now that that's allowed.
We have a question from SB Lescano. Are we testing, once a person is tested and they're tested 3 times positive, are they counted once or 3 times?
The state of Florida has 2 different measures of positivity. They have positive results, which includes if somebody's tested multiple times, and then they have a measure called positivity. That is only the first time that somebody is tested. So they have 2. They're looking at both. They're looking at all the times that somebody gets a positive test, regardless of it's the first time they got tested or the second or third time that they got tested. But they're also looking and they're measuring. And really, that's what they're looking at is the positivity rate, which is when the first time somebody tests positive. Even if they have subsequent tests that test positive, they're really only counting it as 1.
Any other questions? Anything else you think?
No further questions.
Got it. So bottom line, if you do have any questions, we'll give you another minute or so. So bottom line, just wear your mask. I think that's the most that governments can't regulate, right? We can't regulate free speech. So if you have 100, 300 people, 1,000 people that get together outdoors and they want to advocate, they want to protest, they want to advocate or protest anything, government cannot stop that. And the same thing goes for house parties. Somebody wants to have 50 people over their house, government is not allowed. That's been one of the big issues that our county commissioner, he talked to me yesterday about it, our state senator, I know the county mayor has mentioned it. Those are 2 areas that are specifically protected by the Constitution. So even if you were able to contact trace COVID cases back to huge house parties, to protest, what are you going to do with that data, right? We can showcase it, but I don't know if you can't regulate. And that is where it becomes very difficult. And I think that's why you saw the county mayor pivot towards what he can't control. And I think it becomes very hard on that end. And maybe those are the areas that epidemiologists and the infectious disease experts need to speak out more about and make those decisions. But I do know that there are other places here in the town that are voluntarily closed. I know there's a church here locally that spoke to me, that told me that they're closing their doors for the time being, and they're going to go back to virtual. So I do hope we start seeing that trend again of things getting normalized. I know that there was flattening the last 3 days of those cases, which is a good sign, and we're seeing more and more people leave the hospital. Anything else, Clara? So no
other questions.
So thank you guys for tuning in. Reach out to us, 305-364-6100. That's 305-364-6100. I know there's still a lot of great things here happening in our community. We got to keep showing resiliency. We will win, right? This virus will not defeat our community. We will get past this, and we got to keep staying together. Council, all of our volunteers